Hey everybody, time now for Real Men Wear Gowns. It's our campaign to get guys to put on that hospital gown. Be proactive with your health. And Dr. Barry Milbert is here today to talk about something all men need to hear about, which is colorectal cancer and the foods we eat. Thank you so much for being here today.
Thanks for having me.
So let's first talk about colon cancer. We keep hearing that the rates are rising. What are you seeing?
Yeah, that's absolutely true. And colon cancer is the #2 cancer killer in the United States now, and it is one of the ones that's most on the rise. And the scary thing, I think, for me is that we're seeing more and more cancers in folks under the age of 50. The national screening guidelines did reduce from age 50 to age 45 back in 2021, but we're still seeing an increase in colon cancer and rectal cancer despite that.
So what's behind this?
Well, we think it's multifactorial, but one of the big keys that we are seeing is likely due to the food supply. The European Union allows about 350 chemicals in their food supply. In the United States, unfortunately, we allow over 10,000 additives and chemicals in our food supply.
That's eye-opening.
It is. It is.
Wow.
And so what's thought to be the case is that exposure of these various chemicals, if you think about, starting from infancy, certain baby formulas and baby foods, and then as we get into our younger years, we love candy, we love processed foods, Cheetos, whatever it looks like, and being exposed repeatedly to those chemicals changes what we call our microbiome, so our bacteria that live in our gut. And over time, we get changes, interactions with the lining of the colon that causes precancerous polyps, and ultimately those can lead to cancer. And so we think that we're seeing it at earlier ages because of these exposures to these chemicals in the food supply.
Which is why you also wanted to talk about the foods that we eat. So what is your advice when it comes to what we're buying at the grocery store and what we're eating?
Sure. I think, as much as anything, the more fresh foods that we can eat, our vegetables, our fruits, meats get kind of a bad rap, but honestly, whole and well-sourced meats are fine. There is some correlation between red meat and colon cancer, but there's a much higher correlation between processed meats, your deli meats, your bacon, your hot dogs, things like that. Any food that has, 5 chemicals in it, probably not great for you. Some word that you can't pronounce, probably not great for you.
So what is your advice in terms of what to look for and watch out for?
As we said, so screening starts now at age 45. But people that are younger than that need to pay attention to symptoms. And so chief among them, I would say, would be rectal bleeding. We tend to think of, any rectal bleeding we see as being hemorrhoids, and that may be true, but it certainly could be, a big polyp or even an early cancer. Also, things like change in your bowel habits, unexplained weight loss, or any sort of anemia that you might have needs to be investigated.
Dr. Milbert, thank you so much for being here.
Thank you for having me.
Appreciate it. We've got much more at WTHR.com/realmenweargowns. Check us out online.
All right, well, we've got a front and we've got plenty of